It's Tuesday on Your View. Welcome to the show. I am Murayo. For Labby Brown, as always, I have the ladies. Hey, YK, the building.
Yo,
how you doing?
I'm fine, thank you. I'm fine.
Anything interesting?
The Lagos state government, they have started to tar part of my area. In fact, one road is totally tarred.
Which is Lagos State? It's not Ogun State.
No, Ogun State have now started another road, Sabu, is now Ogun State. Ogun State have started that one.
Well, Lagos State was the one doing your own area.
No, Lagos State, there are two, you know, our place is a border town.
Yes.
So you have to, when Lagos State started, I asked them, I said, are you Lagos or Ogun? They said Lagos. So I know that those ones were Lagos.
Okay.
So they've done, even done up to Greenland.
Okay.
Or they're doing, that's Lagos. Now, Ogun State have now started that major Sabo.
Oh,
that
wow. That bridge. So necessary.
That means December will be
Okay,
nice.
once it's done, please, we have to come and visit you. Me, I will personally
They
drive.
do our own personal, you know, because that
From
long
that
road,
bridge to your own house. That road
nobody has gone near there.
That place is terrible.
And
You need to fix it.
the last person that touched it was Benga Daniel. This was like
Many years ago.
12, we're talking 12 years ago. So
Hopefully.
I'm in full prayer. I'm in full prayer so that our cars can last. We don't have money to buy new car. But
I love this color on you, IK.
oh, thank you very much.
What's this one called today?
It's between peach and pink. It's
Okay.
in between, you know. I don't know.
I would have called it pink, outright pink.
No, it's not outright pink.
Okay.
This is pink. See?
That one is peach to me. That's not
your
pink.
tab is
Your tab is pink. I shall no color.
The tab is pink. I don't have peach now.
Okay, anyways.
I manage myself.
How you doing, Nima? You are yellow today.
Okay, yeah. Okay, we have colors.
Nima wants to rant. Please rant.
I'm upset. Yesterday.
Who's upsetting you?
Yesterday, I confirmed the abuses of hijabites for data capturing when I had to recover my SIM at a particular network. The one I'm wearing the color.
You to mention
The one I'm wearing the color. And, you know, I got there, and this young man said, you know, to take my picture, I had to take off my hijab. I looked at him, one young man, obviously. And when I raised my voice at him, he denied, passed me to his boss. That one said, hey, just, okay. And, you know, you really do not have to. The NCC has given that directive. As the hijab rights advocacy, we've continued to issue out those directives as we continue to face with them on the rights of hijabites. Nobody has to see anything. My international passport, I didn't have to do all of that. So why are you asking me just to recover a SIM? Why I'm swearing an affidavit to? That's a legal document saying I'm the one. And if I'm found wanting for it, I can be prosecuted for it. Why are you complicating issues? You know, asking those kind of things. I can only imagine what other young people would do, but I'll take it to a proper office now. These are some of their small outlets that they allow their staff to come to. And the lady, Kate, had to run away yesterday. But today, I'm going to their office to recover that SIM because, you know, I've had it since 2009. I had lost it when I was with the man's pregnancy.
I think that's just the story of our country.
You know,
yes, we make laws,
and then
but
we don't enforce. We leave it to the discretion of the officials. We should always, you know, train our officials properly and make sure they understand these exceptions. So we leave our officials to do what they like, and then you have an official abusing somebody like me as a representative of your corporation. You should ensure that those kind of things don't happen.
Okay. Is there anything else? The traffic can go, truck, trailer?
The tanker, Nupen called off their strike, so they are parked all the way from Alakija, loading. They're parked from Abiola, in fact, loading all the way to Erikmon this morning, loading, facing the depots and loading, causing serious traffic.
That's why you're late a bit today.
I was a bit late, yes.
Okay, Bele. Madam Ranta, chief ranter of your view. But yeah, I mean, I think we can go on a quick break. But I just hope that the Nupeng issue is resolved soon enough, and I hope the trucks are able to use the parking spaces that are offered by the government. And I think NPA and Lagos State government are supposed to arrive at an agreement.
Like gentlemen, so that when their rights are abused, people would feel for them. They took a break, and all of us were enjoying ourselves on the roads.
Okay, let's go on a break. When we come back, we'll go through the front pages of the papers. Stay with us. We'll be right back. Okay, we're going to start with the nation. Insecurity, Buhari blames lean resources and COVID-19. 60% of COVID-19 cases in Lagos, Oyo, FCT, Edo Rivers, says PTF. Picture here of suspects and bandits that were captured in parts of Kaduna State. Oyo Deputy Governor joins ZLP. 95-year-old survived COVID-19 in Oyo. Varsity's admission to begin September 27th. Okay, our president is speaking and he was blaming lean resources.
Yes, he said, 2020 has been a very, very peculiar year that, they've tried, and the governors must commend the Nigerian military for, the installing security in the states except for Borno. He admitted that, they've not met the needs of Borno people in terms of security, but they've tried their best in all other states, in the Northeast. Adamawa Bauchi and all the other, because it was Northeast Governors Forum that went to visit him, talking about insecurity in that region. And he was saying, 2019, COVID-19 has really, it came with its demands, and we are not even different from the US. We are dealing with so much, and we must...
See, we played this...
different too.
In terms of how this has stretched our resources.
I'm just saying that US, they have conducted millions of tests. We are still on 300,000.
Aside from that, Seth, I think this COVID card is going to be played all throughout this year and even till next year. All our politicians are going to tell us that XYZ did not happen because of COVID-19. Yeah. So we're kind of used to that rhetoric. However, I guess what's more important is he's saying that they need to do more. Now that more is what Nigerians are saying. What does more mean?
No, the highlight for me is what Zulum said, because let me just quickly combine it in the other paper that, the poverty, the difficulty in that area is forcing people to even join Boko Haram, and that should concern the president, because people no longer have control of their farmlands, and if the Boko Haram are in control of those areas, they might need to show allegiance to an insurgent, for them to feed.
Yeah,
so I think that should worry President Muhammadu.
When you're talking about there is Southern Kaduna, there is Benue. There was yesterday there were killings in Benue.
Yeah,
so we can't say that we are doing well.
Anyway, the reports our president gets is totally different from the reports we get. But either way...
He affirmed that we are telling him that they are not doing well.
Moving on to the Punch. PTF blames governors for crowds at Edo rallies and Kashamu's burial. Lagos SARS personnel brutalized extort man for holding brother's passport. I've done what Mimiko couldn't do in 8 years, says Akeredolu. For Shomole, Edo's election is do or die, says Wike. Gunmen killed 13 in fresh Benue community attack. Principal who failed to receive Fayemi during visit suspended. Sage attacks Malami panel, forged suspects' testimonies. The registration ruling, INEC confused on judgments, heads for Supreme Court. Okay.
So, Professor Sage.
Can I just take this? Please. He was going to Akure, and he went through the Ekpe road, and they stopped him. The police stopped them, searched the whole bus, and when they got to him, searched him, they couldn't find anything. They now got his bag and found his brother's passport. And then they now proceeded to beat him, take him to the station. They beat him, and they asked him for 1.5 million. He said he didn't have 1.5 million. They took him to get to the ATM, 55,000 or so they took from his account. He said luckily he had small money on him that he used to get to his... And how he brought this to the attention of the police, he tweeted it. The police replied, and they have returned his money.
They said they won't dash him extra.
They dashed him extra.
Wow.
So he's grateful.
That's fantastic. When the police is working, let us acknowledge
it. In fact,
so the tweet he tweeted, police investigated, gave him the case number so that he could track it. After that, they now refunded his money with some. So Nigerian police could possibly be our friend. That's a strong possibility.
No, they've shown.
They've shown that they can be our
friend. And with
yesterday's
human interest as well.
Yes.
Where they had the person charged for murder.
Okay, let's find another story. Yes, Sage.
So Professor Sage has criticized the entire Justice Ayo Salami panel, except for Justice Ayo Salami himself, who he shows that he has said that has more integrity and is assured of him ensuring that justice is done to Magu, the EFCC boss that is being probed. He has criticized other members for being representatives of agencies that have allegations against Magu, and even bringing witnesses from people that Magu is investigating presently, or those on trial, that he said that does not show a balance. And he said that they should not hold him to the statement quoted last week that he said that Magu would not be prosecuted. That what he said was that he was sure that he would not be prosecuted on the allegations by the Attorney General of the Federation without proper investigation by the right authorities.
Can I just talk about the principal who Fayemi suspended? Yes. He got to the school, she wasn't there, and you know there are some certain protocols that they were supposed to adhere to. Yeah. She wasn't there to ensure.
So he was impromptu. He attended.
I believe they didn't say it in the paper that it was impromptu, but it must have been because you know the governor is coming. You will make sure you are there.
You'll be there. You'll be there with your best dress.
So she wasn't there.
She wasn't there. So he has suspended her. There's no Omashe in the matter. Your work is your work. You have been trying to start. Now
I think Fayoshe used to do that kind of thing too. You just impromptu enter the secretariat. Moving on now to Daily Trust. Boko Haram kills 223 civilians, 89 security agents in 7 months. That's between January and August. How Kano singer backed death sentence for blasphemy. 13 killed in Benue chieftaincy tussle. Bandits disguise women, abduct 2 in Katsina town. Pantami commissions 11 more ICT projects today. And Nigeria yet to reach COVID-19 peak despite 945 deaths. Okay, I know it's still connected to the Boko Haram story, so they're still talking about the meeting. The young man, 30-year-old, that was sentenced to death. I don't know if you guys read that story.
Yeah, I didn't read it, but I heard it on the news. Yeah, a singer. They have accused him of blasphemy.
Yes,
and he's
been executed by hanging.
By hanging.
Really, really intense.
I'd like to read the details of that story.
Through the Sharia courts.
Sharia courts, yes, thank you, Waike, for reminding us.
It's quite sad.
Yeah.
You know, because, well, one of the comments on the radio this morning was that, well, you know what the law is
in that area.
So it's either you adhere to the law.
Yeah.
Now, because I'm not of that religion, I find it difficult to understand. Yeah.
But then again, he has a right of appeal within a few number of days.
Moving on to Daily Sun. Northeast governors expose Boko Haram recruitment drive. Malami writes Buhari denies allegations of corruption. Fire raises area market in Abba. Buhari never denied us audience. Anambra monarchs. Okay, I read that story. The fire that raised in Abba. Really, really sad. Billions of naira, billions of goods, billions of goods worth many goods worth billions of naira were destroyed in that fire. It started from the kerosene turning over and burning, I think, some mattresses, and then it started spreading also. Wow. And that Abba is obviously one of our major industrial communities in Nigeria, where quite a bit of goods are being produced. Many goods that we have in Lagos here are coming from Abba, and that market is a very, very popular market. And obviously, they're also protesting against the government, saying that they didn't respond on time. There was really, really low response.
There should be a fire stand within that market.
From the fire stand, fire extinguishers. It should be mandatory for each shop to have.
No, Ariara market is one of such markets that, just like the trade fair, you'd expect that they have their own fire service station within the market. There's no question to that. I wanted to take Malami's story.
Yes, go ahead.
So
Malami took it already.
Please take it.
Okay, go ahead.
Never take it too. Malami don't answer all of us that we are saying, you know, with the videos flying everywhere that he bought 3 properties and some properties for his children, said he didn't get this office. He didn't get to the Attorney General's office a poor man. He said that he had done declared his assets to the CCB, and all his properties were properly listed before in his first term and in this term, and that, you know, he's written a letter listing those properties to the president again, that you can verify. I own this property from having businesses in food, hospitality, and a lot of other businesses before he became Attorney General.
Moving on to the Nigerian Tribune, Northeast governors tell Buhari why insurgents are able to recruit more. UTME JAM shifts admission date to September 7th. Lebanon government resigned after deadly Beirut blast protest. ASU set to replace IPPIS with UTAS. NUPEN calls off strike, reaches agreement with Lagos government. Chieftaincy tussle claims 13 in Benue community. Mass defection looms in APC PDP as Ondo deputy governor quits PDP for ZLP. And COVID-19, no testing done yet in 85 local governments across 20 states, says PTF. All right, this sorry, Waike.
The Ondo State government, the governor,
go ahead.
He has defected again in
deputy governor.
The deputy governor, sorry,
from PDP.
He has left PDP. We are assuming because he wasn't made governorship candidate, and he says.
ZLP. What does ZLP stand for?
Zenith
in the Labour Party.
Labour Party. Zenith Labour Party.
Labour Party.
Okay, any other? We have to move on. Unfortunately, we can't take any more stories. But interestingly, the Lebanese government resigned.
Yeah,
after that,
the Prime Minister has announced it.
Yes. Yeah. What does that mean? That means everybody goes home and they get a new interim government?
You know, because I don't know about their politics, but you know, there is a president and a Prime Minister.
Right.
So I don't know if the president has resigned as well. Yeah. If it's all encompassing,
we'll get more details.
The Prime Minister and his own party.
We'll get more details of this. Let's go on a break now. When we come back, we'll discuss our hot topics. Stay with us. Don't go anywhere. We'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So, the trend of breaking COVID-19 protocols at funerals and events are becoming quite worrisome. According to reports, there was a huge crowd at late Senator Buruji Kashamu's burial recently. Even Abba Kiyari, former Senator Abiola Ajimobi, lawmaker Bayo Osinowo's burial, and a few others. This has led to a major concern among the Nigerians, especially the Presidential Task Force on COVID-19. I know yesterday they lamented that they actually pointed the blames at the governors of these states. But I'd like to hear your views on this, because sometimes, yes, it's easy to point fingers at the governor, but sometimes I think it all boils down to us, the people. You can call us on 070-806-6814. You can tweet to us at TVC Connect. Please hashtag YourViewTV so we can read your tweets. The question is, why are we breaking these protocols? Some people are saying we're a cultural community. You know, you cannot have burials without support and family. It's almost impossible. So yes, you have the guidelines, but you also have to find a way to understand that there is culture. But at the same time, how do we marry the fact that we have a pandemic in this whole cultural display?
I think it's lack of responsibility on our part. Let me tell you why. Because I just had somebody close to me who had a COVID-19 death. And I saw the way, I mean, apart from that, the body was decontaminated, it was sealed, you couldn't open the coffin. You know, so all those measures were taken, and then you had to wear your gloves and your masks. And then in the church, we were only 40 or less. And everybody, you know, was spread out. So, and then we left. I mean, people watch it on Zoom. It's difficult because we have that culture of we want to celebrate our dead.
Yes.
We want to say goodbye to our dead. So it's difficult, but it's something that I don't know if it's the government that has to take the responsibility of explaining to people how this thing is spread.
Or sometimes when we talk about politicians, they have people, they have followers, they have supporters. These are people that he was probably like their patriarch. You know, he was the one supporting them all for many years. So can you tell these people not to come and say goodbye to somebody who has been a support? So that's another question I'd like us to discuss.
Look, there is a way you can carry that body home without their people knowing. You can do it secretly, carry it to the burial ground. Well, I don't even want to talk too much. Nima has just had the experience of her father's death.
And it's tough dealing with family members. So what I insist is that follow what I did. Or my family agreed to do, make it a very private event. My father had 5 children. All 5 of us were present at his burial. We did not allow our mother leave the house, and we asked every other person who wanted to come for burial to visit the house. His students, older and younger ones, wanted the burial to be done because he was a Islamic scholar teaching, and usually he starts to a lot of people. They wanted that body brought for the janaza to be done on him. And I insisted that janaza, whether large or small, is janaza. We don't want, because we understand the situation we are in right now.
Right.
So what is important is that there's somebody in the family, like YK mentioned, her person took control of the situation. You make sure that things follow an order, and you stick by that rule that you have put on ground, no matter whose source is God. The people would talk. for people like these politicians, a lot of people at the burial are people I call eye service people. They want to show. They're not really mourning. The real people mourning are those who know what it takes to lose that person. In fact, there's someone very close to my family that I thought was the closest to my father. And within that week of his burial, the person had a birthday party. And, you know, pictures were flying everywhere. This person was crying and wailing on the phone when I announced his death to her. I was wondering, why are you making this? He's my father now. But I am still mourning my father. Right. I lack the number of hours of sleep that I usually would have because I'm always thinking about, you know, the moments that I didn't spend with him. The things that I thought I would... Yesterday, we were just discussing something, myself and my husband. I was like, I wanted to buy this thing for him. Now, and they're finally sending me the package. I know he's not alive to use it. I am constantly mourning him. Yes. So the people shouting and wailing there, they are called wailers. They bury away. If you go to Auchi, they come, they will roll on the floor for you. They will go home and eat eba. They'll be fine.
So, you know, is now who's going to take that responsibility? Because, you know, let me even relate that to when you go to public places, they put no entry, no mask, no entry. But yet, people are entering without masks. Everywhere. They'll put these signages out there, and you think people are not complying. So the point is that, is it the government who will blame again that people are not compliant, or are the people? We are simply not taking responsibility.
Let's talk about religious leaders.
COVID, very glaringly, it was made public.
Yes.
Some of these politicians died of COVID. And you carry your body and go there to go and wail.
There's also the point of Nigerians not believing in COVID till date.
Right.
A lot of people still don't believe. They don't come to the markets. They don't understand what the problem is. Until you are wearing your mask in the market, in trade fair, even in Ketu here, they'll be looking at you that you have horns, like you have horns on your head. People don't understand. They don't trust the system. They believe this is a gimmick by government to make money. Right. And as long as within their circle, maybe one person just died in a malaria you get, and one person was sick actually and the person got better, it's malaria. I had an argument on Saturday. People, in fact, I was the only one who believed there's COVID. And I said, I tested positive and they rushed me. What do you know? What do you know? We have been having this code since.
I know a lot of people like that
people attacked,
will have their businesses. Nima on her page that government had paid her, that how much did she collect to announce that she had COVID-19, you know? So people don't believe. Where the government has a responsibility is to continue to feed that information to people. Look, it exists. Whether they believe or not, and at the end of the day, you will take responsibility for yourself. Me, I have taken responsibility for myself. I take responsibility for my family.
Yes.
And people close to me, my staff. Right. I take responsibility. Like my staff, they still don't come to work every day. Just twice a week. In fact, let's not even go there. Yeah.
But why, because there'll be more burials, as we know. Yes. People like COVID is still here, hasn't gone. And we want the objective of this conversation is to make public suggestions on how people can do this, especially when politicians or somebody really important passes on. They have supporters. Is there any way
I believe
these burials can still be done where we don't have crowds?
Yes. Those families are not responsible.
Yes, obviously.
They have not taken the responsibility, and they know what kills their person.
You can cut off the public.
How is it possible to cut off the public?
These families can cut off the public.
How?
If small me and my family, 5 of us can do that.
You are bringing the body from Lagos, for example. You are following the body
come at 6 a.m. before anybody knows. You don't share the information.
The events with anybody. And it's not a Muslim burial. You can keep it private. You don't have to do a small janaza and all that, find a private location for burial and all that. But the truth is, as long as rallies are happening in Edo State.
Exactly.
Rallies are happening somewhere. They are doing by-elections in Nasarawa, and people are doing whatever they like in campaign places. People will continue to say they do campaign. Just like they said in the Waye case, they want to have an election, but they don't want to write.
Let me take this call from Ekundayo. Are you there? Thanks for calling.
Yeah, good morning, Mariah.
Morning. Go ahead, please.
Yeah, thanks for this topic that you are discussing. And I want to say that I'm one of your ardent listeners.
Thank you, sir.
Yeah, thank you very much. As for this crowd control, I think that we need to educate the public. There is no way, because of our cultural background, there is no way we can control or we can put a limit on the people that attend burial. That's part of our culture. But we can educate the people, like wearing masks and all those safety regulations. That's one part. The other part, as to whether people believe COVID or not. I don't know if you have seen this video by the president of Ghana, which was saying that COVID-19 is actually a product of the laboratory. So when you have this myth surrounding a particular pandemic, people are bound to take different positions.
Right.
That's my contribution. Thank you.
Thank you very much.
So really, government is to blame for me. If government in their politics forget what the rules are and you go into crowd, we saw the videos of a sitting governor, doing his campaign in every of the states that elections are about to happen, and then you come back and tell the people, hey, there should be social distancing. We have COVID, though. You're saying it, but you're not showing it. Nobody will believe it. And our people have cultures that they believe strongly in. When their dead dies, their loved ones dies, they must show, they must give them what they call befitting burial. Befitting burial includes the paparazzis, all the crowd work and everything, and people coming to wail, and how much of food you give your people. Imagine, 40 days is approaching that my father passed, and they are expecting us to fry akara and do all the works. But that's not necessarily the sunnah. The sunnah means that you pray for the dead and you visit or you do other things. But nobody follows that. Our culture has really, really moved into our religion. So people are expecting all that food and party. Someone has called me, what are we doing? Are you going to fry something?
August 2nd was my father's 23 years and my father passed. We did akara, but we did not do akara and call a party. Yeah. We did akara and we took it
to different people, yeah.
Locations.
Yeah. And so it's not, you can celebrate or you can mourn, but you can mourn responsibly. That is my point.
Yes, fantastic. Let me take this call from Yakub. Yakub, are you there?
Mariah, I'm there. Good morning.
Thanks for calling. Go ahead, please.
Sister Anima, good morning. Sister Yeni, good morning, ma.
Good morning.
Good morning.
Easy, Mariah, I came to realize in this country that we have two laws. One law for the elite, the other for the we ordinary masses of this country.
Exactly.
Mariah, what is the difference between what Naira Marley did in Abuja last time? Although I'm not his fan, I'm not his support of his music, but Mariah, if you look at what that guy did in Abuja, that make the government to conflict that guy, make him pay some certain amount of money. And then if you look at the election that are going on in Edo State now, the campaign, and then just suppose it with the burial of Buruji Kashamu and all that, you will see that Nigerian government, we are not yet ready to cope this pandemic. Why? Because as a family of that Buruji Kashamu, as Sister Anima rightly said earlier, you can cut all the people out. Because this pandemic is here. It is only God Almighty will help the whole world to defeat it. Sister Yani said something earlier, that he takes precautionary measures. All those precautionary measures that Sister Yani is taking. Look at these people now. Now, if there are some certain people in this gathering now that meet those guys working in Sister Yeni's company, what are you telling me? All those precautionary measures that she's taking, it is all I say. So the only thing is this: we can only pray to God. And then if you go to market, as Sister Nima said earlier, you will believe in you, Morayo. You will ask yourself a question. Does people believe this thing is sexy? Because if you use those fake marks in market today, they will be looking at you as somebody that is crazy. Why? Because the Nigerian government does not pass that information to us very well.
Okay, point taken. So we're pointing at the government again, but Faiki, I'm going to go on a break. But the truth is, we've seen all over the world that the COVID-19, how the citizens also took responsibility. They won't say somebody died. I know, as I said, culture is also a factor here. But if we as a people know that this thing is within us, is amongst us here, you stay home, somebody died, you probably go and visit them at some point when things are a bit more calmer.
Go on your break. I want to answer you there.
Okay, stay with us. We'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So, as I said before the break, there's a part of the government, no doubt, but there's also the part of individual responsibility, because it wasn't the government that went to go and get those people from their house. Come on, oh, the politician is coming, oh, come and escort him to the grave.
This is why I talk about responsibility. Because you said something before the break, and I wanted to tell you about where government has a responsibility. When AIDS first came to Nigeria, this was 86. In 86, in all of Nigeria, maybe we had 3 cases, if up to. Nigeria was very AIDS-free. Now, if at that time, I remember my sister was in London with my mom, calling us, there is AIDS. We in Nigeria, was which AIDS? I beg, there's AIDS because the adverts that they were hearing there were different from what we were hearing. We didn't believe in AIDS. Because nobody was telling us, there was nothing on TV. So we were just, My sister won't tell you more. When she came back to Nigeria, there was nothing on AIDS. She too did not believe in it again. But when she was there, where the government, any second, TV everywhere, they were talking about it. Radio.
Why can't they
hold on. Big billboards. Look, it is not enough because if it was, let me finish. If it was enough, people would be wearing masks today. That's number one. You see, it is what is in your psyche, what you continually tell somebody that they now believe. That is one. Number two, then the politicians, like this one that just died, where they are irresponsible, their families are irresponsible.
Yes.
I'm serious. Why I say that, and I say it with all sense of responsibility. When my father died, Talo Popular, who is more popular than Fela in those days, even until now Fela is popular. We knew that to get Fela's body from the mortuary to TBS at that time would be an impossibility if we do it openly. So what we did, everybody woke up, 4, 5. By 5:30, we have carried the body. It was dark. So nobody knew we were taking our body to TBS. And we got the body there before people started, and by 9, come and see crowd. By 9:30, 10, see crowd. We could not control the crowd after that because we did it. So we knew we had to get the body to TBS.
Right.
About 4 people saw us. 4 people still saw us. And they still came out and hailed. But so if these people really, really care about their people, which is my problem, do they care about their people? Because these people, they're not believing.
Yes, now because of what?
They're not believing.
Yes.
Okay.
And they're coming out and they are endangering their lives and the lives of thousands, millions of other Nigerians.
Okay.
Also, people don't put the figures well. So we have 940-something deaths, but we have done only about 300,000 tests in our country. So when people are looking at it, they say, only now that we are 20 million. You've not asked how many people have been tested, how many people have not been, how many people are asymptomatic like me that will be greeting you, will have only small symptoms, and we can still be moving around. Whereas it's not everybody lying down that is sick of COVID.
The PTF, so that is, sorry.
We're not doing the right figure, we're not doing the balance. Then government's role is...
I think, and I'm not trying to speak for the government, but I know there's been quite a bit of sensitization. Maybe it has reduced now. In the earlier days, it was everywhere.
No, it's not reduced.
But yeah,
I was going to disagree with YK as regards sensitization. Of COVID, though, there's more than enough sensitization.
I believe so too.
Everywhere you turn your face, there's COVID.
It's just that there's
even all our statues in Lagos,
yes,
they are wearing masks.
Yes.
So we know. But what is government doing in their own public gatherings that people see? The governor of Ogun State was at that burial. We saw him in the videos. And we saw people will say, Shebi, they say, is it not the person that said we should stay at home that is showing in the video? People will not take it seriously.
Sonny, my papa, I'll come to you, YK. Sonny, are you there?
Yes.
Thanks for calling. Go ahead, please.
Yes. I want to thank you for some of the program that you're doing. You are part of the people that are enlightening the public.
Thank you, sir.
The government is saying, do what I say, but don't do what I do. That is the problem. Because I was here when Abba Kiyari was buried, and the way they go about it is making the people to believe that this thing does not exist. It's not the public, it is the government. I'm there when I listened to the other lady, that Muslim lady Bayo Osinowo right there. She was saying exactly what is happening. So it is the government's fault. The government are not sincere. Even during a time of palliative, they were playing politics with it. So all these things make the public not to believe what is going on. That is truth about it.
Thank you very much. We have to wrap up on this.
Yeah, I just wanted to say, you see, there is sensitization, and I'm not saying the government, okay, look at PTF. Before, it was every day. Now, we hardly see them.
They've told us that destiny is in our hands.
So, PTF that is talking, gone, they have their own... They promised us in April, I think, or was it May? In April, by July, we will have done 2 million tests. Come on. They've done 300,000, if up to. I'm not sure of the exact figure. So even they are not taking the thing seriously.
Okay, well, either way, we have to wrap up on this, but I think...
Okay, sorry, I'm sorry. Because the thing is, it's really affecting me.
I have to wrap up on this, but I think bottom line, yes, governments have their responsibility. The people too must also take responsibility. And when the politician passes on, yes, let's respect the family space. Yes, they're important. Yes, they are people that we look up to in many ways. But it's a period to allow their family mourn. In your own, if you don't show up at that burial, they won't say, Lagbaya did not show up, because they're gone. So I think we should understand that burials also do not mean that we must all gather there to go and escort the dead to the gravesite. Unfortunately, that's all we can take.
Are we taking tweets?
Quickly, no? If I can take in maybe a couple of... Do you have any tweets?
That Matilda says, many officials of some organizations are not fully aware and enlightened on the standing order and updated policies of the organization they represent. I think it has to do with the lack of proper communication and update from these organizations. Someone sent a picture of a rally in Edo State, and Ogumola Emmanuel says, it's just irresponsibility, just like YK said. We live in a country where same laws applies to us all differently. I'm sure the task force wouldn't find it difficult to enforce laws if it was Bobrisky or any other ordinary citizen.
Right.
This life not balance.
Yes, Dolani Roberts says the same way you can wear a mask to the supermarket, the same way you wear to the polling station. Election can be executed safely with proper protocol, no gathering at polling stations, social distancing, and sanitization, hand washing stations.
That's all we can take. Let's go on a break.
The rich people, they are flying.
We'll be right back. Stay with us, don't go anywhere.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So, we're told that Governor Gboyega Oyetola's administration in Osun State has rehabilitated more than 300 primary health centers and about 3 of the secondary health facilities with constant supply of drugs and consumables. We're told that he has also delivered 5 COVID-19 isolation centers. To confirm this, joining us on the show is the State Commissioner for Works and Transportation, a member of the Osun Special Health Intervention and Revitalization Committee, Honorable Remi Omowaye. Good morning, sir. Thanks for joining us this morning.
Yeah, good morning, Mariah. Good morning, everybody.
So, we're told that your government received $20 million to revitalize the health sector. Could you give us a breakdown of how that money has been spent?
Yeah, thank you very much. The government of the state of Osun, under the leadership of Gboyega Oyetola, got a grant under the SOMIL Saving 1 Million Life Initiative of $20 million. It was not Osun alone that got the money. Several other states in Nigeria got the money. And so far, so good. We have been able to invest the money into the health sector. As I speak, we have 332 PHC, focal PHC in Osun. When Governor Gboyega Oyetola came in, he promised to revitalize the 332 PHC. We have 332 wards, so we are doing 1 per ward. And as I speak now, we've done 300. We use the word revitalization, not even rehabilitation, because it goes beyond rehabilitation. We would rehabilitate, ensure we make it functional. That's why we're using the word revitalization. And apart from doing over 300 primary healthcare centers, the remaining 30 are under construction, but we've done about 300. We've also done a few of our general hospital. General hospital Ejigbo is completed. General hospital Ifete-Edo. Then our main state hospital, which is at Osogbo, we are also doing a lot to rebuild the hospital. We have renovated a lot of the wards, and we are building a 120-bedded hospital facility. We're also doing a 30-flat doctor's quarters within the state hospital in Osogbo. So we've done a lot. Right. And apart from that, we have also invested so much into health insurance, particularly for the vulnerable, because the vulnerable might not be able to afford premium. So we've done a lot around that area too. But more importantly, it is not just building. it is making it function, and that is what we've done. We have also worked on the salary of the medical workers.
Okay.
So as to also encourage to work well in the facility.
All right.
So Saving 1 Million Lives initiative is targeted at, revitalizing healthcare centers. Is it part of COVID, grants, or just, rehabilitation of hospitals?
No, it's not part of COVID. Okay. Saving 1 Million Lives is just an initiative to improve maternal and child health. Because we discovered that if your primary care centers are not well structured, there will be a lot of pressure on your secondary health care facility. So Saving 1 Million Lives is just targeted at improving maternal and child's health. But of course, because it's also an integral part of the health sector, so there's no way it won't also dovetail into COVID management.
Okay. Yeah, are you, do you have the doctors to man these 300 hospitals or 300 primary healthcare centers? Why I'm asking is because there was a governor that built a hospital in, I think it was Akwa Ibom, and there were no doctors for the hospital. When he had an accident, he went abroad for treatment. So I need to find out, do you have the...
Well, we cannot put doctor in all the PHCs. We don't have enough doctors, but we're also working seriously to recruit more doctors. You can't put doctor in all PHCs. The way it works is you have some doctor to man a number of PHCs. Because basically PHCs are not where you treat major illness, but at the moment we don't have enough doctor in the service, but we are recruiting more doctors. And we are also encouraging the doctors that are working at the moment. That was why we came up with the improved comment salary for medical practitioners in Osun. Not only doctors, we also have other medical personnel that work in those facilities. So we are recruiting more of them. As a matter of fact, we've gotten to the final stage of getting to recruit more doctors.
All right, so what kind of
more health personnel?
What kind of incentives are you planning to give these doctors? Because quite a number of them prefer to stay in the cities where they can earn probably more. And also, what YK said, I also think is very important, because I think primary health centers do need doctors, because we need people who can make diagnoses. I'm not sure when somebody comes in, who diagnoses them on they're ill? Is it going to be a nurse? Or how is it done? So if you're saying doctors don't need to be at the primary health center, it's a bit worrisome.
Yeah, that was why I explained that we have about 1,000 primary care centers in Osun.
Okay.
But the ones that are functional are about 800. But the focal PHCs, that is one per ward, is 332.
Okay.
So we are not going to put doctor in each of the facilities. Okay, the way it will work is some of the facilities will come together, form cluster. A doctor will oversee some of the facility. The structure we have at the moment is a local government structure. So each of the facility will have the way it will be managed. So I can tell you that. And part of the incentive for the doctors is making sure that there are consumables, apart from salary, there are consumables and there are equipment they would require. But I can also tell you that in all the focal PHCs that we have in Osun, basic equipment according to World Health Organization standard had been provided. These are part of the incentives you give the doctors. And because our people, particularly those in the grassroots, can now afford to even pay for medical services. We have also instituted health insurance, and we have supported the health insurance to a tune of over 600 million naira for the vulnerable. So the doctors are encouraged, the nurses are encouraged, facilities that are required for them to work out have also been provided.
So Honorable Remy, when you talk about providing insurance for the vulnerable, I'd like to bring it to basics. So in Lagos, for instance, when you go to a primary healthcare center, you get treatment, you get immunization for your children, for your babies, and you get that free of charge. You get, drugs for children below 12, I think, for free of charge. All pediatric treatments are free in those kind of centers. Yeah. So when you say vulnerable, in what category of people qualify as vulnerable in Osun?
Generally, we would refer to vulnerable to the aged and those below certain age, and those that do not have the capacity to pay premium. For those that are in the rural, that everything they get as salary in the month is 5,000. You won't expect such person to be able to pay premium. So they are also in the bracket of vulnerable. So we take care of those below certain age, children, and the aged, as well as those who don't have capacity to pay premium. So if you go to our facility now, everything, they'll give you everything for free. Things that are managed at the level of primary healthcare centers. And we have so structured it in such a way that if our primary healthcare center cannot manage your challenge, you will be referred to the nearest secondary healthcare facility, that's the state hospital or the general hospital. So and the good thing is we are already seeing results.
Okay.
Before now, Osun used to have a very high maternal mortality rate, but lately it has dropped significantly, which is an indication that our investment in the primary care centers are working. I mean, because
Honorable.
I can't give you the data offhand, but I can tell you that our neonatal and maternal mortality rate had reduced drastically.
Okay, so if you are sick today, would you go to a primary healthcare center?
Depending on your sickness. If it's
no, I'm talking about you.
The basic thing.
I'm talking about you.
Yes, I go to the primary care centers.
Which one?
Well, it depends on where I find myself. We have over 300 ready now. So there was a day I was traveling. I went to inspect one of the road and I was feeling tired. And I went to one of the nearby primary care centers. I actually wanted to see if it was functioning. And I was surprised. They gave me anti-malaria after they conducted tests on it. I had malaria. And
so you confirm that they have labs?
They didn't know I was a commissioner for works.
So you confirm that they have functioning labs for testing, for diagnosis?
Yes.
Okay,
for basic diagnosis, malaria, and for the basic thing that you manage at the primary health care level.
Do they have PPEs?
Yes.
No, you won't. PPEs, you won't have that at the primary healthcare centers.
Okay.
But our primary healthcare workers have been trained to manage any patient they suspect that is having COVID.
Okay.
COVID cannot be managed at the primary healthcare level. But they have been trained so that when they see any patient that they suspect is having COVID, the patient will be referred appropriately. We have also provided ambulances. So all they just need to do is to escalate it. We have a short code emergency number 293, and they have been well trained. So they will just escalate it, and such person will be moved to the nearest nearest center for management of COVID.
Yeah, the reason I asked is because it can be very contagious. So if your doctors. They're not protected, if the staff are not protected, they too may contract the disease. That's
yes, I agree with you. I agree with you. We've invested so much in management of COVID in Osun, and we continue to train our workers because new things comes out from COVID. Before now, they will tell you once you have COVID, you won't have it again. But today, we are having cases of people that have been cured of COVID reinfection.
Okay.
In fact, one of our healthcare worker has a similar case. So we are investing so much in training and in management of COVID patients. So
how many tests have you done?
We have to wrap up. We have to wrap up, but I'll tell you this, Honorable. I have family in Osun that's staying there right now, and I will call them up and I'll ask them to visit a healthcare center, and I'll tell them to take pictures.
No, they can go to any. We have over 300 of the primary health centers are ready, so they can go into any of the primary health centers. Morayo, remember the last time I came on your program, you alleged me of something, and I said you should call, and you called to confirm. So,
that's
okay,
all right, I'll get back to you. No problem. Thank you very much, sir. We're going to go on a break now. We'll be speaking with the Commissioner for Works and Transport and a member of the Osun Special Health Intervention and Revitalization Committee, Honorable Remy. He's one of their spokesperson. Yes. He's the one they send out to speak. He's always very. No mind him. Let's go on a break. We'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So our final segment this morning, according to reports, hair loss affects millions of men and women every day. 1 in 2 men will experience hair loss in their lifetime, while 1 in 4 women will suffer from hair loss or sometimes thinning out. Needless to say, 1/3 of women of African descent have traction alopecia, a form of hair loss due to pulling of the hair. Joining us on the show is Ayo Otubanjo. He's a senior consultant with the world's leading specialist hair restoration company, Vinci Hair Clinic, and a partner in the Global Medical Group. Good morning, sir. Good to have you on the show.
Good morning. Good morning. I'm glad to be back with you.
Yeah, I'm trying to see if you have some hair. You don't have hair, do you?
Well, I'm one that naturally prefers not to have hair. I'm not bald, but I prefer not to have hair. I just like a clean, shaved look.
I think, I'm trying to see if I even asked this question the last time, but a lot of women usually experience hair boom, I would call it, during pregnancy. All the hormones are working, they look beautiful, the hair is full. And, you know, I had that experience. I mean, basically, I don't have hair. I started having lots of hair in my front. And then the baby came, and everything started falling off. Now, are there hormones are there things you can use to retain this hair that we get, especially during pregnancy?
That is such a brilliant question, and I get asked this question so many times. Basically, it's all to do with your estrogen levels. So when you're pregnant, your estrogen levels are very elevated, and that is why most women would tend to grow hair and have a lot fuller hair than they previously had. Now, once you've given birth, and your estrogen level goes down to the normal level, the excess hair that you acquired during pregnancy naturally falls away. There's no way of keeping it because you never really had it. It's just because of your condition, the pregnancy, that allowed you to have those excess hair. And that's why most women tend to look really beautiful and very lovely when they're pregnant.
Thank you. So, sir,
I'm sorry to burst your bubble, but there isn't any drug that you can take to maintain that same hair that you had during pregnancy.
Point taken. Go ahead.
So I wanted to know what can we do to help save women losing their hair? Because I had my hair breaking when I had it permed, that's relaxed with relaxers, and I stayed off relaxers for years, but it's not stopped. Nothing changed. In fact, it got worse. So every time I have to take off my weaves and do another hairstyle, I lose a lot of hair. I wonder if there's something left on my head. So what can we do to help women, stop that?
There's a lot of preventative actions that women can take. I mean, we see a lot of women in the clinic with all manners of hair loss due to tight braiding, something we call traction alopecia. We see women with another condition called cicatricial alopecia, which is basically as a result of the chemical relaxers, or sometimes the way hair is actually fixed on the scalp. Now, a lot of these things are not necessarily harmful. For instance, I mean, if you're going to do a tight braiding, there's nothing wrong with doing braiding, but why does it have to be so tight? And when you do it, why keep it on for too long? 3 weeks is about normal to keep it, to keep a tight braid on, and then take it off, and then let your hair rest for maybe another 3 weeks before you do another one. So don't do one back to back. And then when you go to the salon, to have your lovely hair fixed, well, I mean, just take a bit of time to look at the product that they're about to use. Has it been certified? Has it been authorized for use on human scalp, on human skin? Those are easily the kind of preventative actions you could take. So a lot of the hair loss that we see are preventable. I mean, they're very preventable. Sadly, there are some that are unpreventable. For instance, the genetic form of hair loss. So if you have the genes which leads to what we call androgenic alopecia, unfortunately, there isn't much you could do about that, except to just notice the signs when it starts and consult with a hair loss consultant to try and find a solution. Let
me put you on hold for a second. I have a call. Good morning. Are you there?
Good morning.
Thanks for calling. Go ahead, please.
My name is Tosin. I'm calling from Abulega.
Hi, Tosin. Good to have you on the show.
Thank you.
You're live.
I would like to comment on the COVID-19
Please go ahead.
topic.
It's your view. Let it count. Go ahead.
Okay, I'm just of the opinion that people like to blame the government for everything. I live in Lagos State, and most of the time when I go out, I see even the statues have, there's a lot of sensitization going on. Well, I live in Lagos State. I don't know about other states, but in Lagos State, I think it's commendable what the government does. But our people are not responsive enough, from my opinion. I've had to argue severally with people saying there's nothing like coronavirus, and they just behave the way they like. During the Salah time, I went to Kara to buy ram. I had to run away from the place because people don't. I told them, what about, we are not wearing masks. What about coronavirus? I said, there's no corona. So I said, but it's killing people. They say,
Right.
you know.
Yeah, thank you so much for sharing that. Talking about coronavirus, Mr. Otunbajo, we're getting the reports we're hearing is that those of us that there's some people that are susceptible to getting coronavirus, those who have hair loss issues. Could you make that connection? There's some kind of study they're doing, I think it was in the US, I believe, that they're making a connection to those who have coronavirus and with some relation with hair loss. Could you tell us that connection, please?
Yes, indeed. I mean, we're learning a great deal about this virus. I mean, so every day is a new revelation. A few weeks ago, some research paper was published, which shows that men who have the androgenic alopecia, that's a genetic form of hair loss, are 4 times more likely to contract coronavirus. Now, that's what the study shows, but I mean, there still needs to be a lot of work done to really validate that, because the data that we're using, very limited data, but so far that's what that's what the study shows. Now, in addition to that, in the UK, where I'm based, we've seen coronavirus patients who have actually suffered quite significant hair loss as a result of this, as a result of the disease. So there is a link between coronavirus and hair loss. And there's also a link between the propensity to develop coronavirus if you're bald. But there's still quite a lot of work that needs to be done. So the scientists are all working on this to try and make us understand even more what this virus does.
Yeah, there is some hair that they sell for ladies, and they get this hair. I've heard that they get the hair from dead bodies, and these dead bodies have mites. And when you put it on the scalp, you can get headaches and different things.
That can be true.
Is this true?
Well, I mean, I wouldn't put anything that hasn't been proven on my skin. Whether that is hair products, whether it's skin products, I wouldn't. I mean, personally, and I wouldn't advise anyone to. You need to know the provenance of what you're actually applying to your body. If I offered you a cream and say, look, it does this, it does that, you wouldn't just take my word for it. You know, you'll go away, you'll ask questions, you'll speak to other people that have used it and find out what benefits they've got. So it's the same thing, it's the same principle, just common sense.
All right, let's talk about men for a second. Men who are experiencing hair loss, especially young men. They're growing, they're at that age. Now everybody's doing beard gang, and we're all trying to have that that look. But there's some people that are having issues even growing that hair. They would love to, but for whatever they're finding difficulty getting that place to be full and nicely shaven. What can they do to help hair grow on that beard area?
Well, you can see I've got a beard, and I wish it was actually fuller than this. You know, we're all born with different traits. Some people naturally, you know, beard comes, you know, they get very thick beard, it comes natural to them. Some people have to work a bit harder to grow the beard. So I would, you know, there are some products you could certainly use, but for beard, the main thing really is just careful grooming. And if all else fails, there's always the possibility of a transplant. And we do that in the clinic. So we actually do beard transplants in the clinic.
So let's talk,
I don't have any.
Let's talk quickly about the different type of hairs. So Africans, we have our own unique kind of hair. You don't want to talk about type that is on my own head. It's coily, it's stubborn and all. So how do you manage differently, an African woman's kind of hair?
Well, I mean, that is the one factor that most women would tend to come up with, when, you say, look, don't relax your hair, don't fix and all that. There are other things you could do naturally to your hair. You could moisturize your hair. I mean, there are several safe products out there that could help you actually manage your hair on a daily basis, African hair, naturally, it's a much difficult type of hair to groom and to maintain, a lot more so than for Caucasian hair. And obviously, that's the reason why most African women tend to wear wigs, which obviously, is from Caucasian people, because it's a lot easier, straight, just comb it, put on, and then you're off to, you're ready to go. But there are other ways that African hair can be maintained, and using very safe products. We're not a hairdresser. We're a medical establishment for hair loss restoration. Right. But in terms of products, there are, you just have to speak to reputable salons, and they will tell you loads of products that you could use for maintaining natural hair.
Okay.
This is not scientific, but I tend to believe that African hair is the way it is because of the sun. So it's curly, so it protects us from the brain from direct contact with the sun.
Is that correct?
The Oyinbo hair is to protect them from the cold, Their ears are protected there. So our own is, so when we now be doing Oyinbo hair, what happens? It's not protecting us from the sun.
Do you agree with my wife case?
So I know it's not scientific, but you can talk about that one. Okay. Oh, no.
Well, I mean, African hair is the product of millions of years of evolution. And there are so many different factors that have actually contributed to the texture and the structure of our hair. Environmental, obviously, is one. I mean, we live in a tropic climate. And whereas Caucasians live in a more colder climate, and basically the body and the hair has developed over millions of years to take account of all those climatic conditions.
Right.
But look, hair is hair.
Okay.
Whether it's Caucasian, whether it's African.
Let me pause you for a second. Let me take this call from Certainty. Good morning, Certainty. Are you there?
Yes, ma'am. I am here, Auntie Morayo.
Go ahead, please.
Yeah. Actually, I want to report a hot topic to you people. There is a more pressing issue that is happening in this country that I need you to at least give it a try and then hear the view of people.
Okay.
Yeah, it's about this empower issue. These people that are disengaged, seriously, they are they are undergoing a lot of problems. This is not the right time for them to be disengaged.
Empower. Okay, I know our producers have heard, and they will probably work on that. Mr. Tumbajo, let me ask you. I'm not sure if I asked you this before. Also, I was in a car accident many years ago, and I do have a scar from my here all the way to the middle of my head. Now, on that line, I don't have hair on it. The entire stretch of line. You talked about transplant or some kind of skin graft. For someone like me, I never for me, I just left it. I mean, I can't be bothered. But when you mention transplant, can I still have hair on that line? Because that line doesn't have hair all the way to the middle of my head.
Yeah, that's a very good question. The scar is a very difficult skin tissue to actually have a hair transplant on.
Okay.
Because it's not, I mean, the skin itself has been kind of disfigured. So, technically, you could still have a transplant, but the chances of the follicles being viable are much reduced when you have a scar. Now, that doesn't exclude you from trying, obviously, but the chances of those follicles being viable are much reduced than when you have a normal skin and you're implanting the follicles in a normal skin. Now, having said all that, I mean, we've treated a lot of patients in our clinic who have developed scars from accidents and all manners of things. And there is a procedure, a cosmetic procedure we call scar pigmentation. which basically camouflages the scar and makes it blend with the rest of the skin. So where you have a scar, like you said, in the middle of your scalp, now we can pigment that scar so that it blends in with your hair and the scalp, and it's not visible. Nobody would even know that there's a scar there, and that's the beauty of scalp pigmentation. Right. So maybe you need to come. Maybe you need to call us and come in and see what we can do for you.
When you come to Nigeria, we'll talk about that.
So I wanted to talk about. You know, a lot of women desire full, long hair, and African women too. So what procedure would you prescribe, or what would you do if someone was to visit your clinic to give them that kind of hair they desire?
Okay, let me share a joke with you very quickly. I mean, we've had a couple of women have actually come to us saying, "Oh, we offer hair transplant. Oh, brilliant! Can I have hair like Naomi Campbell? You know, going all the way down to my hips?" And we said, "No, that's what hairdressers do. Africans don't have that kind of hair. I mean, some people might have very lovely hair, and when relaxed, might be long, but most cases, African women don't have that kind of long hair. Now, if you were to have a transplant, what we're doing is we're transplanting your follicles, which will grow your type of hair. It would not grow a Caucasian type of hair, because although scientifically, it's possible for us to transplant a Caucasian follicles into an African's scalp, and chances are it probably will grow. But guess what? You would then end up having to take anti-rejection drugs forever, just for you to maintain that hair. And quite frankly, it's not ethical.
It's not healthy.
Unethical.
It's not healthy.
And that's the reason why we don't offer that third-party donor transplant procedure.
So if I come to you for a transplant, you would transplant the hair to my head, and then my hair would grow. It will continue to grow.
Yes, correct.
Thank you very much.
Correct. But you're the donor, so that hair will grow just like your normal hair grows. What I'm saying is, if you want the kind of Caucasian long hair, which goes all the way down to your waist.
Yeah. Unfortunately, we have to wrap up. Thank you so much.
Relax that hair?
We have to run. She was saying that, can we relax that hair? But we'll still have to bring you back, sir. We have to wrap up right now. We've been speaking with Abiola Bayo. He's a senior consultant with the world's leading specialist hair restoration company, Vinci Hair Clinic. They're in the UK. Hopefully, they can have a branch in Nigeria soon, so we'll go and check it out. All right, have a fabulous, fabulous day. We'll see you tomorrow. Bye for now.